Welcome back. The Asian Development Bank has approved the Indonesian government's loan of $450 million to finance COVID-19 vaccination. Converted to rupiah exchange rate, it is equivalent to 6.53 trillion rupiah.
Vaccine financing to Indonesia is included in the responsive COVID-19 vaccines for recovery program by Asian Development Bank or IDB. The program is continuations of IDB assistance to Indonesia to address the pandemic challenge. The loan will later help Bio Farma, state-owned pharmaceutical company, to obtain and distribute COVID-19 vaccines. ADB President Masatsugu Asikawa said that the financing can fund the purchase of vaccines of up to 65 million doses of vaccine. From all sources, IDX Channel.
The Asian Development Bank has approved $450 million loan to Indonesia to help Biopharma, a state-owned vaccine supplier, to procure and deliver safe and effective vaccines against COVID-19. The loan is included as ADB's project to Indonesia, so-called responsive COVID-19 vaccines or recovery projects. So what it's all about? Let's see the first graphic to know more detail about it. Responsive COVID-19 vaccines for recovery project from Asian Development Bank to Indonesia. The first one is fund the purchase of at least 65 million doses of COVID-19 vaccines, help the Indonesian government protect lives and restore livelihoods, and supported by ADB's Asia Pacific Vaccine Access Facility or APVAX. The project is supported by ADB's $9 billion Asia Pacific Vaccine Access Facility, or so-called as APVAX, which has been launched in December 2020 to offer rapid and equitable vaccine-related support to ADB's developing members, including Indonesia. However, nothing comes for free, right? For a vaccine to be eligible for APVAX financing, it must meet one of the three criteria. Let's see the criteria in the next graphics. This is eligibility of APVAX financing. The first one, procured via the COVID-19 Vaccines Global Access Facility or COVAX, pre-qualified by World Health Organization and authorized by stringent regulatory authority. And through the eligibility, Indonesia is qualified to get APVAX financing, at least one of the criteria in which the vaccines will be procured through the COVID-19 Vaccines Global Access Facility or COVAX. Therefore, the Asian Development Bank has approved $450 million loan. Through the loan, it will help immunize millions of socially and economically vulnerable people at high risk of transmission, including the medical personnel. ADB will also help the government and biopharma improve logistics management and deliver vaccines more effectively. And actually, this is not the only assistance that Indonesia gets from ADB. ADB has helped Indonesia in many ways, such as giving grant, loan, or humanitarian assistance. So let's take a look at earlier programs through the next graphic. This is the list of ADB assistance to help Indonesia. The first one is $3 million Asia Pacific Disaster Response Fund grant to help the Ministry of Health deliver critical medical equipment and supplies. $1.5 billion COVID-19 Active Response and Expenditure or CARES program, loan as budget support for urgent public health, and $450 million responsive COVID-19 vaccines for recovery project. And I would like to highlight the CARES program. Even though it was covered by Asian Development Bank, it was co-financed by Australia's Department of Foreign Affairs and Trade, the Japan International Cooperation Agency, German Development Corporation, and the Asian Infrastructure Investment Bank. Indeed, the good deeds which is provided by Indonesia is ADB commitment to achieve a prosperous, resilient, and sustainable Asia and the Pacific. And Indonesia is part of the target. And about the responsive COVID-19 vaccines for recovery project, IDB sees that Indonesia needs it most as the pandemic has significantly affected livelihoods, especially among the poor and vulnerable. About 30 million people in Indonesia have lost their jobs or have been forced to cut working hours, resulting in an increase in poverty. But Indonesia has high hope as vaccination program is now ongoing and can be one of the way out to solve the problem. But the problem is about financing. Yes, same old story, right? The government has allocated a huge budget for handling COVID-19. And let's take a look at the next graphic to know the detail about it. This is the Indonesia's budget for handling COVID-19. In 2021, the total budget, as much as 130 trillion rupiah, will be divided into 3 programs. The first one is vaccination, of course, 58.18 trillion rupiah. Testing and tracing, 9.91 trillion rupiah. And healthcare and medical personnel incentives, as much as 61 trillion rupiah. High budget comes as Indonesia sets high target for vaccination. The Indonesian government aims to vaccinate 181.5 million people against COVID-19 in one of the world's biggest vaccination campaigns. Indonesia recorded more than 1.5 COVID-19 cases or 40,000 deaths as of March 30th. And we hope that the $450 million ADB loan can help Indonesia deliver safe and effective COVID-19 vaccines. Stay tuned on Market Headlines because we'll be right back after the break.